Okay, so a friend asked me to do I guess, a rebuttal on this op-ed here by Ben Furryman. I don't know, something like that. So he's an Idaho State representative, and in his little article here, he's talking about. He says, so imagine if restaurants were forced to wait 6 months to get paid for its meals already served, or a gas station unable to restock fuel because customer payments are still processing. Well, okay, so in politics, everybody wants to get these ridiculous, hyperbolic arguments out there. Don't compare gas stations and McDonald's to healthcare. You go to McDonald's, you know what you're getting. Most of us already know what it is. I mean, hell, I haven't been to McDonald's in years, and I know if I'm going to go in there, I'm going to get a Big Mac, fries, Diet Coke. Why? Because it's the same. It never changes. A Big Mac is 2 all-beef patties, special sauce, lettuce, cheese, pickles, onions on a sesame seed bun. That's the way it's been since I was a kid. There's no change. There's no difference. When you go into the medical system, things are very, very different. I mean, you have to, you got specialists everywhere. They have to diagnose and find out what's wrong with you. So speed is one of those things that it's not ever going to be there in the healthcare system. Plain and simple. There's nothing we can do that's going to speed up payment when it comes to healthcare. Just the way it is. But the deeper part of this concept here is what it really sounds like is he's going after socialized medicine, single payer kind of stuff. So, he's getting in there hammering on Medicare setting the prices. And then if you provide those services, then you wind up getting paid what they decide you get paid, not what you want. Okay. Yep. That sucks. However, that's not something where we should be subsidizing the healthcare industry and letting taxpayers pay the bill for late payments or payments that aren't to the level that people want. So, I mean, we've got this graph right here, and it's showing administrative costs. So, I mean, this looks really crazy as you go up. So, we're talking about these are countries with socialized healthcare. Oh my goodness, what an interesting comparison. So, yep. They're not spending as much on administrative services. However, they're also rejecting a lot of services. And again, when you look at this chart, I see one country here, the rest of these, nope. This country put a man on the moon. These countries, not so much. So let's stop the stupid comparisons with other countries. We're not other countries. We don't want to be other countries. So continue on. Let's see. Medicare's net spending in 2021 was around $821 billion. If providers were simply paid promptly and fairly, they could cut staff, run leaner, and lower prices for patients. Do you believe for a second that's what's going to happen? Just like colleges and universities. Okay, so we made it so people can borrow money that they can't afford to repay for degrees that they can't use. And so, yep, the colleges and universities love it. They've got great, new, fancy, pretty facilities. It's amazing what that's done for them. However, the taxpayers are still getting fleeced. We have a generation of people who are in debt for stuff that they can't and won't pay back. So let's keep the government out of our healthcare as much as possible. So, growth in U.S. physicians versus healthcare administrators. Yep, okay, that happens too. But here's part of the problem. Here's what we have done as a nation. We have allowed pharmaceutical companies to advertise on TV and advertise over the public airways and everything else. That's a big problem. Our society changed dramatically when we started allowing lawyers to do that. Think about that. Think about those changes. Same thing with pharmaceuticals. So doctors and nurses are wasting a lot of time with people going in there asking for the next big best thing because they see symptoms and things like that on TV and they decide, oh, well, that's what's wrong with me. So I'm going to go talk to my doctor and tell them that I need Plorzipaflop or whatever the hell the new drug is. It doesn't really matter. Let's stop advertising. So again, we have all these problems. But going in and putting the burden on the U.S. taxpayer to pay for slow and late payments for the healthcare industry is only going to balloon the bureaucracy. Ben knows that. He's a representative. He's in the Idaho State House. There's no way he can be in the position that he's in and not understand that when you start doing stuff like this, all you do is bloat the bureaucracy. So, yep, the system sucks the way it is. It's not fair the way it is. But we should not put the burden onto the taxpayer to pay these bills, because if we do, I guarantee you all of this is going to bloat. So let's talk about the VA and Medicare. So as a combat disabled veteran, I have Social Security and VA. So I can get my health care provided by VA facilities, through general community practitioners, through VA community care, and through Medicare. And you'd think that, boy, that's great. It's not. It's terrible. It's horrifying. So here's how this works. So if I use Medicare, I go into the doctor. I see the doctor. He does whatever tests he's going to do, prescribes whatever he's going to prescribe. I visit's over. I go to the pharmacy. Prescriptions aren't covered. Okay. So the VA won't fill a prescription for a non-VA doctor, so I have to pay that bill out of hand, or out of pocket. Then 3, 4, 5, 6 months later, I'll get a bill or a phone call from the provider saying you owe $170 or whatever it is, stuff like that. Also, that sucks. The billing system is bad. It's slow. It needs to be fixed, but in different ways. So VA is its own set of special hell. So let's just go with a live example. So right now, I just called the dentist. I have a toothache, and I need to have it looked at. So I could drive 3.5 hours to the nearest VA dental clinic and have them look at it. But I'm not going to get in there for a month and a half to maybe 3 months. That's if I can get somebody on the phone to respond to me because of a toothache. That is not an exaggeration. That is real. That is what happens in the VA healthcare system. So, fortunately, I'm already enrolled in the community care system with a local dentist. So I called up, talked to the lady there, and she said, okay, well, we can get you in on Monday, take a look at it, but since it's the VA, we can't fix it. That's real. Again, that is a real thing. That is what happens to us. So I have to go in there. They're going to do some x-rays. They're going to poke around, waste my time, waste the doctor's time, and not fix the problem. So then the bureaucracy is going to do its work. It's going to churn. And then within a week or two, I'll hear back saying, hey, yeah, we're going to fix the tooth that's causing you a problem. So that's probably the least problematic of the whole system. So one of the reasons this particular tooth hurts is I took a pretty blunt force trauma to the side of my head, broke a tooth. So same dentist, goes in, same procedure. Go in, verify the tooth is broken. Yep, okay, it's broken. It's not repairable, so it's got to be extracted. All right, we go through that process, get it extracted. Then I needed an implant to replace it. So I go in after it's extracted, they take a look to verify that they can actually put an implant in. Again, this is what really happens. So the same dentist that extracted the tooth already knew that he could do the implant and what was going on, but I had to go to another visit because the VA required that I go to another visit so that they could look at that tooth. All right. So then I get scheduled for the prep for the implant. So for those of you who don't know, what they do is they go in, they cut your gum open after it's healed, after the extraction. Then they drill into the bone and shove a metal stud in there. And from that point, oops, I hit my microphone. Then they let it heal. So they let the bone heal around the stud and prep for the implant. Okay, so the VA approved all of this stuff. However, they have not approved the implant yet. So I still have a little while to wait until it's finished healing before I can go and get the implant. So now I have to go to another dentist visit, wasting his time and my time, so he can look at that stud and say, yep, we can do an implant and put it on that stud. Seriously. Then I'll go back and then he'll do the implant. So I will have seen the dentist no less than a dozen times total for this whole thing, when it could have been 2 visits. So this is why this is the problem. It's the bureaucracy that we've created. The billing will heal itself a lot if we solve the bureaucracy issues. So getting the government more involved in healthcare is always the wrong answer. The government never, ever, ever makes anything better, only worse, period. So keep your grubby paws off of our healthcare, fix the bureaucracy issues, and quit trying to gain more control over our lives through our healthcare system. And everybody who, if you can hear me, again, as somebody who is a victim of the VA healthcare system, do not under any circumstances allow these people to go to socialized healthcare. And they mask it. They call it single payer. Don't fall for it. Don't allow them to do it. I promise the system as badly broken as it is right now will be much, much worse if we allow people like Ben to get in there and do this nonsense.